it's rebranding of the same old, right? It still hasn't changed the ultimate problem of what are we paying for. State of Kansas pays $400 a month for medicines that we can get for $12 a month. Again, it's not that government's bad, they're just bad at it. They don't have a mechanism in place to continually improve the cost and the value. So you can promise Medicare for all. What you're probably going to get is Medicaid for all. If you really dive into some of the interesting aspects of Medicare, they don't pay for your first 3 pints of blood. If you get IV medicines when you're just in the hospital for less than 23 hours, they don't pay for those, right? Your Part B has no stop-loss insurance to infinity. So there's a lot of things that Medicare doesn't cover, and then they'll come after your estate to recoup fees and just all these kind of things. So we don't have a perfect universal system as is.
Americans are capable of achieving extraordinary things when they have the freedom and opportunity to do so. This is American Potential. And here's your host, Jeff Crank.
Well, thanks for joining us for another episode of American Potential. Hard to believe, just last week we celebrated our 200th episode of this podcast. It just flies by, and it's just incredible. So I appreciate you staying with us, continuing to watch on YouTube or listen on your favorite podcast platform. Thank you for doing that. And we talk a lot about healthcare. We're going to talk a little bit more about healthcare today. Typically industry shifts occur gradually, but occasionally they can happen almost overnight due to specific events or a change in the market. For instance, in 2020, there was a change almost overnight from in-person doctor visits to virtual appointments via telehealth because of COVID, which has now become routine for many patients. Now, a telehealth appointment can work better for a patient's busy schedule or save significant travel time for those that are in rural areas. Given this transformation to better help patients, do you ever wonder what other changes might improve the healthcare system? Well, this week, Americans for Prosperity is focusing on healthcare, and they're bringing doctors to Washington, D.C., to talk to lawmakers about the personal option. Now, we've discussed the personal option before, and we've had several guests on to talk about the benefits it offers by allowing patients to be in control of their health care. Now, today, we have a couple of guests who are participating in Healthcare Week. And I want to welcome Dr. Jules Madrigal and Dr. Josh Umbehr to the show. Thanks for being with us, Dr. Madrigal and Dr. Umbehr.
Thanks for having us.
Yeah, thank you.
Okay, well, listen, so first off, I have to ask this question of you, Dr. Madrigal. So Monica always does research for us and gives us a little fun fact. And this one on you is kind of interesting. It says that you're the president of a nonprofit that teaches flying trapeze and other circus skills to disadvantaged kids. I think I have to know more.
It's kind of a long story, but I started it when one of my friends was dying of cancer and I was taking care of her and I needed something to turn my mind off. So I've been a flying trapeze artist for 13 years now. So it was so much fun and so many foster kids can't do sports. They don't have the equipment or they're not in an area long enough that we decided to start this program so kids who didn't have a lot of opportunities could do a really cool, amazing sport.
So I think out of the 200 episodes we've had, we've never had a flying trapeze artist. So congratulations on being the first flying trapeze artist. So we've had a few doctors, a few physicians before, but never a flying trapeze artist. Listen, and we'll start with you, Dr. Madrigal. Tell me why you got into healthcare and you became a doctor.
I was kind of destined to do it. It was definitely a thing where I just tried to I actually have a degree in advertising, and then I became an EMT, and then I just kept getting pushed there and pushed there. The universe, God, whatever you believe in, I strongly believe was telling me I absolutely had to do it. So wherever I've been first on the scene at probably over 1,000 accidents by this point in my life. And this was happening even before I was a doctor. And I was like, if God wants me to be there, I better know what I'm doing. So that's kind of how I became a doctor to start with.
Gotcha. Dr. Umbehr, how about you?
Growing up, my dad was a trash man. And so he's a lawyer now, but we still tell people he's a trash man because it's less embarrassing.
Hey, now that's a good joke right there.
Right?
My son's a lawyer, and trust me, I'm using that one later today.
There's no short emails when there's a lawyer in the family.
That's right.
But, you know, he ran a great business, and I watched that for 20 years. And then when I started working for a surgeon in undergrad and saw the insurance sausage get made, I said, this is ridiculous. It was my first real experience into medicine. We grew up in a small town. We didn't have any medical family. And so it was just that contrast between a business that was run really well and one that was completely ridiculous. So the emperor's new clothes type of thing. I said, this doesn't make any sense. And that was 2000. And from then on, we just kind of kept looking for doctors doing insurance-free models, whether that was with a membership or just cash only, high end or low end, and eventually, you know, got through the educational system and training system, and were able to launch our own practice.
Yeah. Let me ask Dr. Umbehr, I guess I'll go to you first on this. What's the biggest frustration? I mean, it sounds like it's probably government's influence in the healthcare marketplace. Is that the biggest frustration with the healthcare system?
Oh, not in the least. Not for me. You know, we're so far out of the government system in terms of normal insurance and regulations and Medicare and their MACRA and MIPS and all their kind of reporting things. It's honestly, doctors are still afraid to innovate, and we are very good at following instructions and multiple choice questions. And we've put a lot of risk on the line, right? Most of us are early 30s before we've made our first paycheck, and we're already 6 figures in debt. And so they're very cautious, nervous about doing something that could be perceived as different or new. But they know the current system is, you know, causing burnout, and they're drowning, and it's not good for their patients either. So I think physicians in that case are our biggest holdup. Insurance isn't, you know, fighting us that hard because we're out of their grasp. Mm-hmm. The government's not specifically fighting us. So this is kind of, we just need more physicians to take up the baton.
Yeah. So your argument, though, is that because you're doing direct primary care, that's why that's not as much of a problem. It's more the innovation, doctors wanting to innovate. But if you weren't in that, would it be insurance and government interference in the marketplace, or health insurance companies in the marketplace? What do you think the biggest frustration is overall in the system?
Yeah, I still gotta, you know, my broken record is I've always blamed doctors, in part because we blamed everyone else, and that hasn't worked. And it's sort of that interesting, you know, scenario where we say healthcare is bad or broken because of the government and insurance, and we turn around and ask them to fix it. But, you know, government doesn't know more about administering healthcare than I do. Right. They know a lot about paying for it. They know about red tape and bureaucracy, but physicians, we're at the bedside. We're the gatekeepers of all of this. So if we want anyone downstream to have a better idea, it's got to come from us. And insurance can't decrease premiums until physicians find a way to decrease the cost of care. And we keep kind of coming at this solution in the same bad way of, well, if insurance paid more, then doctors could do more, but then insurance premiums cost more, and then people can't afford it, and round it goes. And no other industry innovates in that direction, right? Every other industry, from, you know, Netflix to Airbnb to Tesla, is always finding a way to make it a product easier, faster, cheaper, and better. And physicians need to do that if we want government and insurance to have real viable options to give us something different.
Right. Dr. Madrigal, how about you? What's your biggest frustration with the healthcare system?
No, I have more of your view. I have a lot of patients that do have insurance, and I don't take insurance, but they have insurance, and it's very difficult for me to get through that red tape to get them what they need. You know, if I think somebody has a weird headache and they may have an aneurysm, I have to go through their insurance company. And usually it's going to be more than a 24-hour delay to get an emergent MRI if they have insurance. If they don't, I can get it just like that. So I just think, and the insurance companies are like, well, if they have it, they die, and then it's way cheaper. I just think that I have to, even not taking insurance, I have to make almost everybody who needs an MRI, like even if I think you have a bicep tear, I have to get an x-ray first, or they won't pay for the MRI. I know you don't have a fracture. There's no reason for me to get an x-ray. So I have to pay for, or, the insurance company has to pay for it. And it's just so, like in my small town, it's going to take them an hour to drive there, an hour to drive back to get the x-ray, hour to drive there, hour to drive back to the MRI. And it's called the hassle factor. It just makes everything so difficult that they're hoping that 1 out of 10, 1 out of 20 will say, screw it. Oh, well, if my arm's weird, it's weird for the rest of my life. And they just saved, $500. Mm-hmm. So I just think there's just so many little things you have to go through, and medicines that they won't authorize and things they won't approve, that it just makes it, insurance is just so difficult. And people tell me all the time, oh, I have great insurance. I'm like, have you used it? Have you had something really bad happen to you? Because you may find out you don't have great insurance.
Right. Yeah. Dr. Madrigal, starting with you, why'd you decide to go into direct primary care? And, obviously we can talk about the differences between that and the traditional care that we see in the rest of healthcare. But why'd you decide to go into that?
Well, originally this was traditional, right?
Yeah.
The doctors were the pillars of the society because they actually got paid by people, and the person you work for is the person who's paying you. So actually, I loved that traditional idea. Second, I came from a non-traditional background, which is advertising. I looked at the contracts with the insurance company. I'm like, this is bull. Like, who wants to wait 3 months to get paid? Like, I don't want that. And then the pay rates, they could change at any time. I've never signed a contract like that with anything else. I'm like, I'm not going to do it. And above that too, I'm like, if somebody's really difficult, I want them to cost more. If they're really easy, I don't want to. And I also don't charge people with cancer anything. And I can't legally do that if I take insurance. So one of the ladies who raised me died of ovarian cancer. I'm like, I'm never going to charge people with cancer. I don't want to, and I don't have to. If I took insurance, I would have to. And if people are having a hard time in our small town, we don't charge them. We give a discount to teachers and preachers. I just think it's a lot more fair for the patient and for me not to take insurance.
Yeah. Dr. Umbehr, how about you? What made you decide to go into this direct care model?
Yeah, like the story I mentioned before, we just knew that there was a better way of doing this. You see, as a med student and a resident and a young doc, all the roadblocks and friction spots for doctors and patients. And too often, you hear a lot of people mention them and complain about them, but they rarely actually try to solve them. And I kind of felt like, well, if meds are expensive, what have we done? What have we looked at to try to decide how to make meds cheaper? If insurance is such a pain, how can we function without it? Because we were exploring clinics that did. And again, on some ways, it's just regular good business innovation. No other business is burdened with this much paperwork or red tape or bureaucracy. And so it's silly to continue that. And, the emperor's new clothes of that is you come out and you're a fresh set of eyes and says, look, this isn't anything that's helping anyone, the patient, the physician, the employer. So let's do it different. And the deeper we got into that, the more we could realize, look, we have great business model examples of ways to provide a lot of something, a lot of value to customers in different ways, gym memberships, Netflix, etc. You don't know how often you're going to go to the gym, but when you go, you have tens of thousands of dollars of equipment right there. And for the cost of Blockbuster and a late fee, Netflix got started, and they could give you 10,000 movies where Blockbuster could only give you one at a time. Why would you do anything else? You wanted a model where patients, they don't know when they're going to need care, but when they need it, they want it, and they want it now, and they want it from someone they trust, and they're worried about the price. And those are all business model concerns that can be addressed. And so I think if we take our oath seriously, our Hippocratic oath of do no harm, that has to mean do no financial harm. Although med school loves to teach us that money's bad and it's unbecoming of a physician, it's totally okay for administrators. Then we've shied away from this problem, and it hasn't gotten any better. So by taking an active role in innovating for our patients, to me, family medicine is a love story. Business is a love story. I feed my family by caring for yours. I don't know how you can do it any different. And pulling in a heartless insurance process in the middle, it just doesn't make any sense, but it also doesn't make the care better, faster, cheaper, or easier.
Yeah. So do you find, Dr. Umbehr, that, much like a government bureaucracy is resistant to change and certainly to innovation, right? Maybe could I compare that? Is it fair to compare that to the traditional system that we see in healthcare right now versus a direct care system that is easier to innovate and to respond to the customer, right? Because ultimately that's who you're trying to please. You're not trying to please the insurance company. You're not trying to please the government. You're trying to please the patient in that direct care situation. Would you agree with that analogy?
Yeah. I often joke, government's not bad. It's just bad at it, right? There's not a mechanism in there like a good business to say, all right, how do we get leaner and better? And so it just kind of this red tape monster, the only solution is more red tape. And they don't even see the opportunities within government to copy what's working. For me, a good example is food stamps, right? They created a system that's very much free market driven. There's no paperwork. There's no submission of claims. There's no rack audits to come back. They said, look, the invisible hand of the market is already keeping prices low throughout the grocery store. So we'll give people what they need, which is money to participate in the economy like everyone else. So they can pick and choose the grocery store, and that works out really well. And so how we miss that when we need healthcare and somehow push that back to, we couldn't possibly function without knowing how many strep throats we have, or anxieties or rashes or abrasions. And is this a level 2 abrasion? Well, we'll pay you a little bit more if you do it that, or document it that way. The silliness of the whole system, but we just kept rolling with it because no one ever stopped to ask if we needed to.
Dr. Umbehr, you've been involved with direct primary care before it was direct primary care. So how have you seen it change sort of over the years, and why is it working better now than it was before?
Yeah, it's really come through a very interesting arc. I first joined the concierge medical movement when I was a pre-med in undergrad in 2000. And that was, the early days of it all. So it was really just aimed at the elite, 25,000 per person per year. But it struggled a lot because, of course, there's not a lot of people that can afford that. But docs were frustrated with insurance way back then. They just didn't really apply a lot of business sense to it to make it as valuable as possible. So we watched that movement struggle to get any traction for 10 years as I went through undergrad and med school and residency. So we knew that if you were going to be successful, you had to have a very affordable, very high value model. And that's what we aimed to launch in 2010 when we started our practice. And I think that's really what shifted is docs didn't like the expensive, only for the rich model, but they didn't know what else to do. But they also didn't think a very affordable model would be sustainable. So we had to come out there and show that, yes, you can have the best of both worlds. Here's the pricing, the meds, the labs, the structure. And then, around that time, lots of doctors started moving in that direction. Now, 15 years later, nearly, as doctors saw that this model not only works, but it thrives and grows and patients appreciate it, could you really start to, turn the ship of healthcare? So the arc from expensive and for the few and not working very well to affordable and for the many and thriving. Yeah.
Dr. Madrigal, your thoughts on that? I mean, I think there are people who think an old way about, direct care. who do think, in fact, I've heard it for a while called, and I don't like this term, but concierge care or whatever. And it does make it sound like it's something that only rich people can afford, but it isn't that, right? I'm sure you have many patients who are middle class and working class folks, right?
No, I don't do the same business model. I just do money in, money out. I do it absolutely the old fashioned way, the way the doctor that took care of me when I was little does it. So we just do, you pay for what you need that day.
Oh, gotcha. Okay.
I don't like the membership way because I want it to be across the board. I don't want there to be barriers to care. Right. So I have patients that about 40% of my patient population speak Spanish. I have billionaires in my clinic. I have multimillionaires in my clinic, and I have indigent people in my clinic, and everybody gets the same care and everybody's a VIP here. So I like it that way. I like it if you are kind of a pain and need care every single day, you're going to pay more. If you come in once a year, you're going to only pay that once a year. So the idea is similar though, that you pay for what you get. Nobody else is paying for your care but you, and you have that sacred relationship with you and your physician. So that part's the same.
Yeah. When we talk about a personal option in healthcare, Dr. Madrigal, what does that mean to you, a personal option?
To me, that means that the patient and the doctor work together to decide what the patient needs, right? We have patients all the time. I'm like, your diabetes is not well controlled. Do you want to work much, much harder and do all these great things to keep from needing more medicine? Or do you want to keep where you are and I'll give you more medicine, right? Same thing. You could have a brain tumor. Do you want an MRI? Do you not want an MRI? Obviously I'm going to push for an MRI in that case, but where you work together with the patient's value systems, what's important to them, their financials, what their family needs. You work with them on who they are and what they are to get them what they require medically. And it's very different from what an insurance company is going to list out. We have a new computer program. I'm like, we're not asking people if they have a smoke detector. We're okay with it. I want them to, but that's not going to be part of our medical home. So we really want people to have that option to have a medical home, a place where they feel home. And this is where we all decide together what's best for them. And they get well educated and they know what they want and they can do what they want.
Right. Dr. Umbehr, a personal option. What does it mean to you?
I think it really tries to maximize the value to each individual, right? I can't think of a single product where we only get one of something, right? Other than public school. And that's also not working out great for everybody. Right. And so the idea that your school is assigned to you based on your zip code is bizarre when you think about it relative to grocery stores, restaurants, bars, shopping centers. You would never be limited in that regard to anything else. And if we tried to do that for healthcare, people would revolt in the same way. But more or less, they are overly restricted in how they access and choose their care because, unfortunately, again, I still blame doctors. Until we find a way to make healthcare affordable, most people are getting their healthcare through insurance. And if you have to have insurance involved, whoever, pays the piper picks the tune. And so that inherently means that the decisions and wants and desires of the insurance company come first and contractually. I mean, that's not an evil thing. We've agreed to say, here's a chunk of my money, do the best you can with it so that if I have a catastrophic thing, it's there. But then we also get frustrated when the little pieces don't work either. And so, but we can have our cake and eat it too. Ironically, that's what capitalism is so good at, is bringing the comforts of kings to commoners, that we can have unlimited access to your doctor, calling, texting, emailing, for $50 a month. Right? That you can get medications and labs for up to 95% less. We have one great example on seizure meds where we're 99% less than Walgreens for the exact same medicine. Right? But if you do that, 35% of everything an insurance company pays for is medications. Right? Another 30% is copays. In the same way that Netflix innovated a way to eliminate late fees, Direct Care has innovated a way to eliminate copays. And so if you fix 20% of that 30% and 20% of the 35% on medications, you've already made insurance 50% cheaper. Now, people are in charge of where their dollars are going. They get to decide, do they want Zoloft for $1 a month or Wellbutrin for $6 a month? But now it's their personal decision, and insurance starts to take a back seat to most of these things. In the same way that we do for car insurance, home insurance, and life insurance. So nothing is more personal than your health care. So you should have as much personal say and control over your decisions as possible. And a model that's less dependent on insurance overpaying for things definitely gives the power back to the individuals.
Right. Dr. Madrigal, what comes to mind when you hear people talk about, Medicare for all or the public option? I mean, what's your first thought when you think about that or you hear that?
Restrictions. I mean, we see that across the board. We see that after a certain age, you're not allowed to get a mammogram. You're not allowed to get a PSA. They don't think you need a colonoscopy. And again, that may be true for certain 70-year-olds, but not others, so it just goes to this, everybody goes to this mean, this like, now we're not supposed to teach women how to do self-breast exams because the cost of the time spent is more than the cost of saving people. I mean, it's just, that's not right. So there's so many restrictions if we do this universal kind of policy that it doesn't let people choose and it doesn't let them make good decisions for their health. They're not even given the option. We see people all the time with, prostate cancer and they haven't had a PSA in 10 years because their insurance didn't pay for it and no one told them they could have one. So that's, again, there's no option. People don't get their own choices, and that's not good medicine. Yeah.
And you talked about, actually, Dr. Umbehr referred to the public education system. And, once we focus on individual kids, we start improving the system. Same thing is true, I think, in healthcare. Once you start focusing on individual patients, that's when you see real positive change and innovation in a system. Dr. Umbehr, how about you? When you hear Medicare for all or public option, what do you think of?
I think it's rebranding of the same old, right? It still hasn't changed the ultimate problem of what are we paying for. State of Kansas pays $400 a month for medicines that we can get for $12 a month. Again, it's not that government's bad. They're just bad at it. They don't have a mechanism in place to continually improve the cost and the value. So you can promise Medicare for all. What you're probably going to get is Medicaid for all. If you really dive into some of the interesting aspects of Medicare, they don't pay for your first 3 pints of blood. If you get IV medicines when you're just in the hospital for less than 23 hours, they don't pay for those, right? Your Part B has no stop-loss insurance to infinity. So there's a lot of things that Medicare doesn't cover, and then they'll come after your estate to recoup fees, and just all these kind of things. So we don't have a perfect universal system as is. Before we expand it out to everybody, we should try to fix what we have. But it's just so much easier to market a big, broad solution. And I think that's the real problem, is that it could work. That's what we're up against. If we don't come in and fix it or offer solutions, what's the average individual supposed to think? No one's asking for the government to fix iPhones because iPhones are already great. So that's inherently, not an issue. If healthcare continues to feel expensive and unfair, inaccessible, not equitable, then people are going to keep banging a drum to say anybody fix it. That's where physicians need to take an active role in saying, all right, if I can study this much on how to code insurance, I can also study a little business. How do I make medicines cheaper? Because they still won't necessarily be cheaper under a government plan. They'll just be paid for differently, tax dollars or copays or deductibles. So it's a rebranding of a solution that's not even working right now.
Yeah. Well, Dr. Umbehr, what are some of the things then? What's the most important thing, I guess, policymakers, members of Congress or members of the state legislature, what's the most important things that they can do to improve the system in your mind?
Get out of the way. I feel like is the classic example or answer. Encourage the market. The ideas that are working really well in the market. I can't remember how many election cycles we've talked about the government working to lower prescription drug prices, and they still can't get them lower than I can. I like to joke there's not a billionaire on the planet who provides medicines cheaper than I do, right? We are 80% cheaper than Amazon, 70% cheaper than GoodRx, and 40% cheaper than Mark Cuban, right? Walmart can't even do it, and they're pulling out of healthcare, and CVS. And so everyone's struggling to find a way to make it work while billing insurance. And then the people who aren't billing insurance are screaming from the mountaintop, this is working, but it sounds it sounds too good to be true. But we could lower the cost of 90% of medicines for 80 to 90% of medicines overnight, just with doctors and pharmacists doing what we do with every other item in the grocery store. Just here's a price tag on it. There's a wholesale price. There's a keystone markup, and you go for it. There's no reason to bill your insurance for these things. And so if we want to make insurance cheaper, the first principles would say, well, what is insurance paying for? Make that cheaper before you can make the premiums less. But if name brand Lexapro is $12 a pill at the pharmacy and wholesale or generic Lexapro wholesale is 3 cents a pill, well, at $1.20 a month, you're not even asking insurance to pay for that, right? And when your cholesterol test is less than $3 and your simvastatin is probably under $5 a year, then you're not asking the government to pay for that. And we just need to get back to that model, because that's how we free up disposable income for families who really need it right now. Is you're overpaying for a lot of insurance. And then if we lower the price of insurance premiums by at least 50%, we can cover more people at a better cost. We can avoid medical debt. We can free up all kinds of ways for people to improve their preventative health, because now it's not a decision between money, food, rent, utilities, or your medicine. Well, look, 1,000 metformin will cost me $12. You're good for a year or more for $12, right? Those are the types of solutions the government needs to encourage. And in 20 years of negotiating medication discounts, they haven't been able to do what just the market does, right? Any physician in 44 states, but any pharmacist in every state can go direct to the wholesalers and get these prices. It's not magical. It's not a trick. It's not a gimmick. It's not a volume play. That's just the actual cost of these. And same with labs. An EKG costs my clinic 40 cents. The coffee in the waiting room costs 80 cents a cup, right? It used to cost 70 cents a cup, damn inflation. And so that's the true cost of care. The price gets inflated out to whatever, $100 an EKG, because there's so much overhead. If we just looked at fixing healthcare the same way we streamline, hotels and cars and internet and AI and every other product around us, we'd have an economic boom, the likes that would make Reagan jealous and would last generations,
Right. Yeah. Dr. Madrigal, go ahead. Your thoughts on what policymakers can do.
Well, also get out of the way. And physicians have to be creative to do this. So I can't legally give more than 3 days of medication in Texas. So I can't, all these awesome things he's talking about doing, I can't do them. So I have to be creative in other ways. And lab, again, I can get a CBC for $3 versus at the local hospital, it's $150. So I have to get creative that other way. I have to call my lab company and be like, hey, I need a discount on hemoglobin A1Cs because we have a lot of diabetics. What can you do for me? Have them compete against each other. So we have to get creative in other ways. EKG, I've been in business so long, I can do an EKG for free, so I can just throw that in there if I need to. But we have to find other ways. But there are ways, like Josh is saying, there are ways to be creative. There's ways to do your for me, I just decided how much money did I want to make? How many people did I want to see? Divide it out. That's how I did it. It's not magic. It's not complicated at all. You can keep it really simple and still take really good care of a lot of different people. And like Josh said, it shouldn't be where people are having to decide between getting good care and getting medication and eating or paying their electricity bill. That's not how it's supposed to be. And we can work together to get it to do that.
So the bitter irony for doctors is that it's actually easier to do it this way, right? Like they are choosing the hard way. Nobody gets fired for buying IBM, I guess, but doctors would rather fail in the traditional way than risk succeeding in a new way. And for lots of good reasons. It's risky, it's scary, it's financial, but to go through all the insurance licensing and wait 6 to 9 months to get approved and keep up with the red tape and the billing and the coding and then fighting the reimbursement on 30% of everything you do, having 7 staff per physicians to help you, see 30, 40 people a day and bill insurance. We have 1 staff per doctor, and we see everybody same day for an hour if they need it, right? So it's weird that it's easier, better, faster, cheaper, and we just need more doctors, more patients, more small businesses to say, that's it. I'm fed up with the broken model. I'm aware of a new solution, and I'm going to kind of reach out and adopt that.
Yeah.
And it's much more rewarding. Josh and I get to know our patients. I have 3 patients named after me. I have 3 baby Jules here. We get to go to funerals and weddings. And, it's so amazing. We get to love on our patients and they get to love us back. And I think with the system that's in place now, people don't know their patients. They don't care about their patients. And that makes it way harder to take care of them. And this way is, like I said, it's so rewarding. It's the way it's supposed to be, for us to love on them to love on us to give them what they need, and us to be there for them. I don't mind being woken up at 2 a.m. if somebody really needs me. I don't mind at all. I don't mind doing a house call on a Saturday. If you really need me, I'm there for you. I love being that person. I get to be the hero, and that's what's so nice about this system, is it really is a bilateral, both of us in this together kind of thing. And I think so many physicians are missing out by just working 9 to 5, doing exactly what they're told, and not able to get into the really good stuff. Those
are the kind of doctors we wanted to be when we were, pre-med and applying to med school, and had all hopes and dreams. And, and so it's not that doctors in the system don't care, it's that they can't care. The system is designed to not let them have time to care because there's no profitability in that. And so it burns out the doctors who care the most because they're the furthest behind. They're trying to give every patient the time they need, but then they, robbing from Peter to pay Paul, then their family doesn't seem as much. So really, there's no good reason to stay in the system. If we do love our patients, if we do love our profession, we need to fight for it and fight for those people who are going to suffer at the hands of burnt out doctors seeing 30, 40 people a day. That's hard. It's hard for everybody, but there's ways to fix it.
Yeah. Well, listen, thank you to both of you, Dr. Madrigal and Dr. Umbehr, for joining us and for kind of sharing this with us. But more importantly, thanks for getting engaged and involved with your legislators, with Congress and others to try and make this a more free market system, right? And impose some competition and some choice into a system that badly needs it. So I really appreciate your time today, but really your time focused on these issues and improving healthcare in America. So thank you. All right. Well, listen, both of these doctors are great examples of how if we simply insert choice, we simply insert competition, the consumer and what they care about into healthcare, like we are doing in states with education, like we do all the time in the free market, we're going to improve healthcare. We're going to do it better, faster, cheaper. It's only when government gets involved and insurance companies and they make it overly complicated, overly regulated, when we start to see systems fall apart, whether it's K through 12 education or healthcare or other sectors of our economy. So it's wonderful to have these doctors and others get involved and try and make a difference in healthcare in America. Look, If you'd like to get connected with an Americans for Prosperity state chapter, be sure to send me an email at jeff@americanpotential.com. American Potential Podcast, we're always looking on stories to help keep you inspired and informed. And the best way to stay connected is by liking and subscribing to our channel, as well as following us on Facebook, on Twitter, and on YouTube. And I hope that you will reach out, defend liberty and freedom. And these doctors are doing that. They're defending your liberty, your freedom, their liberty and freedom to practice medicine, and as patients, your liberty to receive that healthcare in the way that you want to. Don't take liberty and freedom for granted. Go out there and fight for liberty and freedom. Thanks for joining us.
Thank you for listening to American Potential. You may listen to more stories from Americans working every day to expand freedom and opportunity in their communities by visiting AmericanPotential.com.